Hello, my name is Madison Major, and today I will be comparing the healthcare systems of Albania and the United States. Albania is a second world country located in Eastern Europe. By definition, its healthcare system is universal. The government primarily funds the country's healthcare and ensures all citizens have equal access to healthcare. Other sources of funding come from a portion of eligible employers, employees, and the self-employed's incomes. However, poverty is not uncommon in Albania, and so only a small amount of citizens are eligible to provide funding. Therefore, many citizens do not receive the medical care they need. There is also a developing private sector of healthcare insurance to cover pharmaceutical and dental services, in addition to some specialized clinics located in the capital. Since costs for these services are not covered under the universal coverage provided by the government, they are only accessible to the people that can afford to pay for them. In the U.S., we have a mixed healthcare system of both public and private insurance. Out-of-pocket payments is our simplest mode of financing. In addition, we have individual private insurance and employment-based private insurance. Finally, the public portion of our system includes government finance programs such as Medicare and Medicaid. In terms of life expectancy, population health in Albania is just below that of the United States. Albania ranks 57th in life expectancy globally, while the United States ranks 41st. The overall life expectancy in Albania is 78.5 years, with an average of 75.8 years for men and 81.4 years for women. In the United States, the overall average is 80 years, with an average of 77.7 years for men and 82.2 years for women. According to the World Health Organization, in 2014, Albania spent just $615 per capita, while the United States spent just over $9,400 per capita on healthcare expenditures. If we take a look at the graph, we can see just how isolated the United States is when comparing health expenditures per capita and average life expectancy. We can also see that even though the US spends far more per capita, we don't have the highest life expectancy. According to the World Bank country classifications, the source of this graph, Albania falls into the upper middle income category. As stated in the previous slide, Albania has an average life expectancy of 78 years, so it would be located somewhere near the arrow. In 2010, the World Health Organization set in place a goal for all Europe to reach 75% for flu immunization rates. Progress towards this goal was evaluated in 2014 and 2015. The only available data for flu immunization rates in Albania was for healthcare workers. In 2014 and 2015, 77% of healthcare workers in Albania received the flu shot, which was the third highest rate in all of Europe. In the past year, the United States had 78.4% of healthcare workers receiving flu shots. This data was further broken up into the flu immunization rates by workplace and occupation. Healthcare workers working in hospitals had higher rates than those working in long-term care facilities. In terms of occupation, physicians had the highest rates for flu immunizations, followed by pharmacists, nurses, and then nurse practitioners and physician assistants. For public and health prevention, Albania does a great job with childhood vaccination rates. Their high rates are due to the use of combined vaccines in 1 or 2 dose vials, allowing children to be vaccinated at any time. 2 examples of the combined vaccinations that are distributed in 1 or 2 doses are DTP, Hep B, Hib, and MMR. DTP, Hep B, and Hib is known as a pentavalent vaccine. It was introduced in the country in 2009 and has been used ever since. In 2015, rates for this vaccine were just above 98%. MMR, the combined vaccine for measles, mumps, and rubella, also had vaccination rates around 98% in 2015. The low rates of MMR vaccination in 2006 was due to a global shortage of the vaccine. In the U.S., childhood vaccination rates are still good, but not quite as high. Although the number is still low, the percentage of children in the U.S. who don't receive vaccines has quadrupled since 2001. Of children born in 2015, about 1.3% of them did not receive the recommended vaccinations. Poliovirus, varicella, MMR, and Hep B are the top 4 vaccinations given in the U.S., all with rates above 90%. The combined 7 vaccine series is similar to Albania's pentavalent vaccine, but also contains the poliovirus vaccine, a measles-containing vaccine, varicella vaccine, and pneumococcal conjugate vaccine. You may notice that this is actually more than 7 diseases being vaccinated for. In this case, DTP is only counted as 1 rather than 3. Rates for this vaccination are significantly lower and have continued to decrease. One explanation for the lower vaccination rates in the U.S. is the fear that many parents have about the potential side effects vaccines may have on their children. We know that in the U.S., far too many parents do not vaccinate their children out of fear. However, in Albania, although 72% of parents are concerned about the side effects vaccines may cause, this doesn't actually stop them from vaccinating their children. Another explanation is that in the U.S., vaccination rates for uninsured children are substantially lower, bringing the overall coverage down. In 2006, Albania adopted a law that banned most forms of direct and indirect tobacco advertising. Violation of these bans requires fines by law. The law also implemented smoke-free indoor public places. Although the prevalence of smoking in Albania has actually increased over the past few years, the risk of secondhand smoke has decreased due to the bans of smoking in indoor public places. The largest impact was seen in medical facilities, followed by government offices and then educational institutions. In 1964, the Surgeon General's report helped significantly decrease the smoking prevalence in the United States. However, from 1964 to now, 2.5 million adults who were non-smokers have died from secondhand smoke. Each year, smoking during pregnancy results in more than 1,000 infant deaths. Secondhand smoke can also lead to heart disease and stroke in non-smokers. The risk for non-smokers to develop heart disease increases by 25 to 30% when exposed to secondhand smoke and causes over 34,000 deaths each year. The risk for non-smokers having a stroke increases by 20 to 30% and causes more than 8,000 deaths each year. There are many more harmful outcomes that can occur from secondhand smoke exposure. While the U.S. does have many smoking policies set in place, it appears that they may need to be reevaluated. When looking at access to care in terms of the number of physicians, Albania does not look great. Within all of Europe, Albania has the lowest proportion of doctors for its population, just 115 physicians per 100,000 people. There was not data available to compare the number of primary care versus specialty care physicians. However, in 2013, a study was done in which 132 physicians participated. 59 were men and 73 were women. Of those 132 physicians, 42% worked in primary care, while the other 58% worked in specialty care. We can see the trend of having more specialty physicians is also present in the U.S. In 2016, there were 271.6 active physicians per 100,000 people. Of them, only 91.7 were primary care physicians, while 179.9 worked in specialty care. The social and economic environment of Albania is on an uprise. Unemployment rates are lower than they have been in the past several years. The current unemployment rate in Albania is 12.9%, which is still relatively high overall, but one of the lowest rates the country has seen. The highest unemployment rate in Albania was at 22.3% in the fourth quarter of 1993, and the lowest was 12.1% in the fourth quarter of 1996. We can see that these rates are much higher than that of the U.S., which currently sits at 3.7% for unemployment rates. The highest unemployment rate in the U.S. was 10.8% in November of 1982, and the lowest was 2.5% in May of 1953. Overall, it is clear that Albania is a second world country rather than a first. Even with universal health care coverage, many Albanians still lack the medical care they need due to the poor economy of the country. However, this is beginning to change. The life expectancy in Albania is relatively high at 78.5 years. The country's healthcare spending of $615 per capita is average for its life expectancy and income status. Flu immunization rates are the third highest in all of Europe at 77%, and childhood vaccination rates are very high at 98%. The high vaccination rates in children are due to the use of combined vaccines in 1 or 2 dose vials. Secondhand smoke exposure is a risk in the country. However, it has decreased due to the laws that have implemented smoke-free indoor public places. A drawback to the country's healthcare system is that there are only 115 physicians per 100,000 people, which limits citizens' access to care. However, the country as a whole is doing better, which can be seen with unemployment rates being lower than they have in the past, although 12.9% is still relatively high. While Albania does have some similarities to the United States in terms of healthcare, overall it is quite different. If you have any further questions, here's a list of the sources I referred to. Thank you.